Hi, my name is Chris Armijo, and I will be presenting my evidence-based practice project coupled with my planned change project. My title of my project is Implementation of an Education Intervention Program for Caregivers of Cognitively Impaired Older Adults. So this is take a look at the table of contents. We'll start off with the introduction, significance of the problem, the evidence-based practice project questions, the summary of the evidence, review of the literature, recommended best practice, policy and protocol for change, and then followed by the implementation and evaluation. So just a quick introduction. There are many forms of cognitive impairments. This can be from Alzheimer's, dementia, Parkinson's. There's different diseases with the Lewy bodies. So it does range. Cognitive disorders such as dementia is not a normal aspect of aging, although it often affects older people. So cognitive disorders range in severity. The normal aging process is associated with declines in certain cognitive abilities such as processing speed and certain memory, language, visual, spatial, and executive functional ability. But some can also have mild cognitive impairment, which is a cognitive decline that is abnormal for age, but doesn't interfere with their function and activities. This is considered the at-risk state to develop a degenerative dementia. So the cognitive impairments are a nonpartisan disease where people from all walks of life are affected. A few celebrities that we may know that had cognitive impairments are Muhammad Ali, who had Parkinson's, Robin Williams, who had dementia of Lewy bodies. We have Bruce Willis, who has aphasia. And we also have Michael J. Fox, who had Parkinson's as well. I'd like to start off with a quote. This quote is, "Parkinson's is a slow but inevitable process. It's hard living with it on a daily basis. The difficulty facing people with it is that they can never quite know, can I or can't I do this today?" And I think that speaks volumes for this project to get in the mindset of where people who have cognitive impairments are coming from and how we can better assist them, more specifically with this project. So for the significance of the problem, we have the cognitive impairments affect 1 in 9 older adults, and 2 out of 3 older adults have some form of mild cognitive impairment, which we had just discussed. The cost for this annual health care for a person who has cognitive impairments is roughly $40,000 a year. So there's an article released by the CDC that said the help of caregivers provided over 18 billion hours of unpaid care for those with cognitive disorders. So those hours actually equated to about $238 billion in care. So we could see how educating caregivers and implementing a plan to better educate them to help the cognitively impaired would be cost effective and helpful for all. So this research that I'm doing will be addressing a pressing healthcare issue, enhancing the quality of life for those who suffer from cognitive impairments, providing caregivers with assistance, and advancing evidence-based caring and cognitive health practices. My evidence-based practice project question is, over a period of 6 months, does implementing a caregiver educational intervention program compared to standard care result in improved cognitive outcomes and quality of life in older adults with cognitive impairments? So this question structure facilitates a direct comparison between the caregiver educational intervention program and standard care. This comparative approach helps researchers to assess whether the intervention leads to a better outcome compared to the existing standards. Or a quick review of the literature. For the databases I used PubMed, Google Scholar, Ovid, and CINAHL. These were the, again, search engines or databases used to look at key terms. Key terms I did use were older adults, cognitive impairments, caregiver education, and current care standards for older adults with cognitive impairments. So for a summary of evidence, I have it Compared to those with cognitive normal abilities, people with cognitive impairments suffer more hospitalizations and spend more money on healthcare. So through these summary of evidence, I will be quickly taking note of the importance of what I had gathered of the resources I had looked up. I'll give you these quick key points and then I'll give you a little bit more information after. So the next one would be the evidence demonstrates that caregiver engagement can significantly improve the health and quality of life of those with Alzheimer's and other dementias, which is very true. And current practices for healthcare workers managing mild cognitive impaired patients primarily focus on investigation of family history or current medical history and medication. So as you can see, there's not a lot of association or involvement of a caregiver. And the last summary of evidence that I wanted to place on this slide would be early detection is key. So caregiver interventions help improve the outcome of impaired patients and improved caregiver mental health as well. That has to do with the early detection. So there were a couple articles that investigated the reduction of cognitive impairment by early detection and completing cognitive activities. So when people first realized that their loved one or the patient themselves were starting to have a cognitive decline, they were able to go to the doctor and be assessed. And with that early detection, they had a plan to help slow down the process because there is no cure. And also completing cognitive activities such as crossword puzzles, doing anything that allows the brain to work, keeps it sharp. So the old phrase that if you don't use it, you lose it is actually very true in this case. Along with this early detection factor, there's a lot of research that there's a lot of research on the patient's outcome, cognitive impairment outcome, how it could be reduced or improved or how it declines, all based on how fast the person disease process is recognized. And also that directly correlates to the caregiver's mental health. Imagine you're a caregiver and you start noticing your loved one is having moments where they, things kind of slip their mind, but you pay no mind. You think that's just part of it. Oh, they're getting older. And then it starts to develop and you miss it and they have some form of Alzheimer's or dementia. Now, your ability to help your loved one is smaller. You're not able to do much for them as far as their treatment. And now you're tasked with having to care for this person. So again, early detection is key in this case. So after reviewing all my resources, I made a couple bullet points about what the rest recommended best practices. And you can see here, caregivers should receive educational support. So caregivers should be able to understand the disease process. How could they help somebody if they don't know the disease that they're helping with? Caregivers should be trained hands-on skills, which I think is very true. If you're having someone where their cognitive impairment starts affecting them physically, how can you go about assisting them in their daily living if you don't know the hands-on skill that you or the patient could get hurt? And then the implementation of therapeutic counseling. So a lot of mental health is involved with both the patient and the caregiver. And I think it's very important that both seek therapeutic counseling or therapy so they can help work through their grievance or their own disease process. Next, I'm going to talk about the policy and protocol for the practice of change. As you can see here, I have 6 icons up here with subjects. We have the 6 policies and protocol for change would be, it would be a state-run program. Patients 65 and up who are hospitalized would be screened. Education would be given to caregivers. Survey for emotional well-being would be performed. There would be a collaboration between interdisciplinary teams for treatment. And then there would be some evaluation. So this is a state-managed program to help facilitate the need of better health outcomes for cognitively impaired patients. Patients 65 and older, they need to be screened and selected when they're hospitalized so we can keep a system. We can have them in the system rather. Education for the caregiver will start by meeting with the interdisciplinary team, which would consist of a physical therapist, occupational, any type of supportive therapy, a psych nurse, and the primary physician, so they can have medications and mental health well-being, and also physical for their ADLs would be managed as well. It would be either online or in person for a total of 3 months, or for 3 times for in person, or online for 3 months, 3 times a week. And the team will go over the disease process and management. Of course, the patient and the caregiver will be there, but the main point is for the caregivers to better assist the patient. So a survey will go out again for the mental health nurse, would also help both caregiver and patient manage their mental health, so there is no caregiver burden or depression during this process. Three alternative approaches to this policy. It would, so at first I had stated that it would be the state's responsibility to do so. Well, in the alternative approach, it would be the individual's responsibility. The program would be created, but the state would have no screening for the 65 and older. So this could help cut down cost and manpower needed to implement this program. Information such as brochures or other information could be online or email or mailed to the patients who are 65 and older, is kind of a screening or a protocol just for people who are automatically 65 will receive it if they need it or not. But by doing this, we risk a lot of people kind of falling through the cracks of the healthcare system. Next, it would be to increase program duration. So I have it set for 3 months right now, 3 times a week. And increasing the program duration would actually help the caregiver. In one study, this Zhang and company did a study where it lasted for 12 months and they had significant reduction of cognitive impairment and caregiver burden because the caregiver was so confident in implementing care. And the last would be creating an electronic health record system. So it would be their own website, their own application, anything to kind of keep track within themselves. So there wouldn't be any loss of, phone call or email, and everything would run fluid. Okay, so back to implementing the original policy. I will have a policy. We'll have to start off at the state level. Social services and Medicaid will be involved in this plan as well. Healthcare workers will carry out the policies and protocols listed above in the span of 6 months. So the original 3 month, 3 times would be assessed at that point and then continue for the next 3. Social services in hospital will be the point of contact for the state to hospital level to ensure all vital information is shared with healthcare staff and patients. Once patient is hospitalized, the caregiver education plan will be implemented and shared with the patient to better help their needs. So this allows social services, this allows screening, shared databases, and more funding instead of having a private entity. This is from the state-run program. Implementation of this program will have to start at such a high level because we want Medicaid involved. So we would have coverage for people who can't afford it, and would also have access to databases that are easily shared. So healthcare workers will carry out these policies and protocols listed above for a span of 6 months, and then reevaluate the program of whatever is needed at that time to make sure all the needs are met. And for that, we will go into the evaluation. So this will consist of also monthly check-ins. There'd be feedback to ensure things are going smoothly on top of a hard implementation. So far we have the halfway point, which is the 3 month eval, the 6 month, and then we have these little monthly check-ins, which is like, hey, how are you guys doing? Do you guys feel like you need any supplies? Do you think you need any more training or like a little bit more information on something? That's how that would work. They make the necessary adjustments needed for the interdisciplinary team to help better manage the patient's care. And the goal for this entire program would be to see that at least 70% of the participants show cognitive improvements. So by that, that would allow for proof that this plan works and that they would further implement this program in either other states or make it a federal plan. So in conclusion, the cognitive disorders impact individuals and families. As we know, awareness, education, and preventative measures are crucial. Collaboration between the healthcare providers, families, and communities is essential for optimal support. Thank you. And these are my references. Thank you again.